North Carolina is at a new high for the number of people in the hospital for COVID-19. Our Damani Lewis is leading our team coverage tonight. Damani?
Well, right now there are 829 people hospitalized in the state with COVID-19, the most since the pandemic began. I'm going to break down how this record could impact the state reopening and moving into phase 3. But first, let's turn now to my colleague Mark Becker, who is live looking at the firsthand impacts on our local hospitals. Mark.
Yeah, Damani, that number 829 is a new high, and certainly the numbers have been moving in that direction for the last month or so here in terms of hospitalizations. Also, 75 or so percent of the beds in the hospitals now in the state, both regular hospital beds and ICU beds, are full, and those numbers are concerning, and they're continuing to go up. And the Chief Clinical Officer here at Novant told us he expects those numbers to go up for a couple of reasons. First of all, simply more people are testing positive for the virus, an average of about 1,000 a day over the last 2 weeks in North Carolina. Even if a small percentage of them end up in the hospitals, that is significant. The other factor, though, is that back in March, hospitals stopped doing elective procedures to open up bed space, and some people simply put off going to the hospital, even for potentially serious conditions. Well, that has changed, and Dr. Sid Fletcher here at Novant told us that is important.
We had a tremendous amount of capacity in early April. We have much less capacity today. We have plenty of capacity to manage what we're seeing, but we are quite busy because we've had patients return to our emergency departments who needed care and needed admission, and we've had patients that needed surgeries or procedures that needed to get those things done that have also returned.
Now, Dr. Fletcher stresses that's important, that people who need to go to the hospital for other conditions do. However, they're going to take up bed space, and if the numbers of coronavirus patients continue to go up, that's going to put a real strain on the hospitals. Damani?
All right, Mark, thank you for that. Now, as we dive deeper into the hospitalizations, listen to this. This could make a direct impact on how North Carolina reopens. Now, we expect Governor Cooper to make an announcement on reopening next week, but Dr. Ryan Shelton with Tryon Medical Partners told us this trend on hospitalizations could determine whether the state will enter phase 3. Look at this calendar right here. 1 month ago, on May 16th, the state had 481 people hospitalized across the state. Well, since then, the stay-at-home order was lifted. People started going back to work and venturing out. And as of today, that number has nearly doubled to 829 hospitalizations. Now, that is crucial, especially if we are talking people are being placed in the ICU.
The most important trend to watch is the number of hospitalizations. So that's probably a better predictor of what's going on in our communities. And that number is going back up quickly. I know our ICUs here locally are much busier than in early May.
Dr. Shelton says this week is crucial for the state to determine if we will enter phase 3. He says it's important people wear masks and remember to wash their hands.